you. By raise of hands, how many here care about results? Good. You've learned results matter at work and results matter at home. Results matters in your community. Results matters with your children. Well, we found that in most cases, to improve results, you have to influence someone to change their behavior. Whether the result you're after is increased profit, decreased costs, or the result you're after is improved quality, or the result you're after is more cooperation on your team, or the result you're after is your 14-year-old daughter cleaning her room cheerfully without reminder. Any of those results require people to change their behavior, and it becomes your job as an influencer to influence them to do something different. We found that change behavior often requires you to help people change their minds. Mostly, behavior change doesn't occur until our minds change or the way we think about what we're doing. So how do you change minds? Well, the good news is to improve results by influencing people to change their behaviors by changing their minds doesn't require a massive rework. You don't have to change everything someone thinks. All you have to do is change the way they think around two issues. Number one, can I do what you're asking me to do? Can I engage in the vital behavior you've identified as important to me? Can I do it? The second thing you have to change their mind about is, will it be worth it if I do? Do I want to do it? Am I able to do it? Do I want to do it? What would you predict for someone if, in fact, they really want to do what you're asking them to do, but they don't know how? Is it going to happen? No. What if they know how to do it, but they don't want to do it? Is it going to happen? But what if they know how to do it and they want to do it? Would you agree it's much more likely? So the focus of changing minds is to change people's opinion around the two issues, ability and motivation. Not about their car preference, unless they're consumers. Not about their party affiliation. I almost said Democrat. Not about their party affiliation, though you could apply these principles to that. But specifically, can they do what you're asking them to do, and do they want to? Well, we found in our research there are three ways to change minds. The first is called verbal persuasion. Verbal persuasion basically says I'll use reason, logic, I'll use information, I'll use facts, I'll tell you why you ought to wanna, right? By raise of hands, how many of you have ever tried to change someone's mind using verbal persuasion? Would you be shocked if I told you it's the number one method managers, supervisors, and leaders use in organizations to change minds? It's the number one most preferred method parents use. It's the number one most preferred method that teachers use, that neighbors use. And our research has convinced me it doesn't work. Verbal persuasion doesn't work. It's a really good way to inform people, a really lousy way of trying to change someone's mind. What we found in our research is that when you resort to words, especially if the words are contrary to the belief I hold, you create resistance. And people resist your arguments. People question your credibility. People wonder if this is sound, just, competent information, or in fact, whether it's folly. Verbal persuasion seems to be based on the naive assumption that if I'm the boss, if I'm the leader, if I'm the parent, I tell you what to do and why, you'll do it. And we found that assumption is fallacious. Verbal persuasion does not change minds. So the three ways of changing minds: verbal persuasion, don't use it. It doesn't work. You know the best way to change minds? Actual experience. Actual experience. Rather than talking to someone or telling someone, give them an experience with the change that you're trying to influence them to engage in. Actual experience doesn't affect us in hurtful ways unless the behavior's hurtful. But if the way we're trying to change people is in positive, helpful ways, then having experience with the positive new way actually changes minds about what's the best way to go. Make sense? Let me tell you about Don Berwick. Don Berwick, he studied the statistics in healthcare and found a lot of people are dying in our hospitals and communities all across America every year due to medical mistakes. They have a term in healthcare called an injured patient. An injured patient isn't someone who had a motorcycle accident. An injured patient is someone we have hurt through a mistake. Well, as he studied the statistics, he was shocked. Number one, how many people are dying in America because of medical mistakes? And number two, how passive we are about it, especially as practitioners of medicine. Don Berwick set a goal. He and his staff of about 12 people decided they were going to save 100,000 lives in America over an 18-month period by changing the way we conduct healthcare. Does that sound like a worthwhile goal to you? Now, I told you earlier, if you want to improve a result, it usually requires a change in behavior. Would this require a change in behavior? If you're going to save 100,000 lives, people have to do things differently, don't they? If people are going to do things differently, you got to change minds. Well, Don Berwick had enough clout because of his connections primarily to Harvard to get a bunch of healthcare executives together. Now, these are people who are in charge of multi-billion-dollar enterprises, all dedicated to saving lives and improving our health. That's the whole purpose for these enterprises. And without exception, each of these executives cared deeply about that mission. Well, Don Berwick presented the data, showed them how many people were dying. He showed them how important this was that we make change. He used about every technique of verbal persuasion you can think of. And people were saying, yes, Don, that is important. And it's one of the 100 things on our lists that we care about and worry about daily. And frankly, it's probably not in the top 10. He was disgusted. He had such a personal fire in his belly about this issue, and others were saying it's one of many issues, Don, one of many issues. He thought about it, and he said, here's what I want you to do. We're going to get back together in a month or so. He said, I want you to go back into your organization. I want you to find in your file an injured patient, someone who was hurt because of a medical mistake. And I want you to investigate that. Don't delegate it. Don't assign it to anyone else. You talk to that patient if they're still alive. You talk to their family. You talk to their friends. You figure out, how did this mistake affect them? Why did the mistake occur? Then I want you to come back and report at our next meeting what happened. So the executives accepted that assignment, went on their way back to their jobs. When they returned, he said, did you do your homework? Everyone nodded. He said, I want to hear about your experience. He said some crusty executives with three-piece suits literally had tears come down their cheeks as they described the pain and anguish they had discovered as they investigated these injured patients and the impact the mistake had on them and their families. Crusty old executives whose head is buried in the world of finance, the world of leverage, the world of data, had tears coming down their cheeks as they described their experience, and each one committed to making patient safety one of their top priorities. Well, you know his goal, save 100,000 lives in 18 months, is a little bit ambitious, wouldn't you say? They ended up saving 122,000 lives as business executives, administrators, physicians, nurses, medical technicians, staff, change the way they did some of their healthcare practices. For me, that's one of the powerful examples of using actual experience to change someone's mind rather than words, rather than reason, rather than data. Make sense? You know, I had the chance to follow Don Berwick. I'm so impressed with him. He's one of the great influencers in America, in my humble opinion. And he went to a group of nurses. Now, these aren't the top-level executives. These are nurses who, day in, day out, are taking care of patients. He wanted to change their minds about making patient safety a priority and adopting a few vital behaviors that would help improve the stats around patient injuries. So, having learned from his experience with the executives, with the nurses, he put up the charts. He showed them the stats. He showed them how many people are not only killed, but injured every year because of medical mistakes. The nurses, already attuned to it, said, yeah, we care. And they said, can I tell you about Josie? Josie King was a little 2-year-old girl. In an unguarded moment, when her mom was looking the other way, she fell into a bathtub of scalding water and got severe burns. The emergency responders came immediately. They grabbed her, took her in the hospital. They worked on her for about a week and turned everything around, and she was doing well. They assured the mom she's on the road to recovery, and probably in about another week you can take her home. Well, Mom had refused to leave Josie's side, and she had a cot brought in, and she spent every waking moment with Josie, and she was so happy and pleased. She was so thankful for the medical service they had provided. Well, as the 2 weeks wound down, it got close to Josie going home. Remember, this is a story Don Berwick is telling these nurses. He said the mom started noticing a change in her behavior. She was acting different than she usually does. Her mom had a hard time pinpointing what is it that's different. But she noticed when the nurse came in that she would bite at the nurse. She would reach for the nurse. Her mom would hold her hands down, and she would bite at the nurse's hand. She said, this is not like Josie at all. When Mom would give her a sponge bath, she would bite at the sponge, and she'd pull it, and she'd chew on the sponge. And Mom said, something's wrong with Josie. She talked to the nurses. They checked the vitals. No, I think everything's okay. She said, I want to talk to the doctor. The doctor came in. She said, something's wrong. She doesn't act this way. She's irritable. She's panicky. She's biting. I don't understand it. The doctor checked the vitals. Said, no, everything's fine. Don't worry. Her mother's intuition said it's not fine. Medical staff assured her, it's okay, don't worry. About 3 a.m. that morning, Josie went into convulsions. The mother held her as Josie died. When they checked into what was wrong, Josie died of thirst. She died of a combination of the medication and dehydration. She wasn't trying to bite her mom or the nurse. She was trying to get water. And that's why she'd bite and chew on the sponge. She was trying to get water. How could they overlook this? This was in Johns Hopkins, one of the most prestigious hospitals in America. Well, it was one of the reasons that Don Berwick took on this mission, and one of the ways he gave nurses an experience with what happened to Josie. Now, the 3 ways you change minds: verbal persuasion. Does that work? No. Actual experience works best. That's where the executives went and interviewed the injured patients. What I just gave you an example of with Josie is the 3rd way of changing minds. It's called vicarious experience. Now, it's best to change minds to have an actual experience. But we can't take all of the workers in America and take them through different experiences with high-performance teams, with the customers. So often what you have to do is come up with a tweener experience, we call it. In between verbal persuasion, in between direct experience. It's called vicarious experience. Now what Don Berwick did with those nurses is he told them a story, a true story about a real person. Those nurses didn't have experience with Josie King except through his telling. And we found stories become a powerful way of creating an experience for someone so that they can identify with the figures, they've had similar experiences, they feel the emotional impact, and it affects how they think about, can I do it and do I want to? Now, you may or may not have some powerful stories that will help people move toward the change you're trying to make. But if you think about it, if you say, what change am I asking? What experience have I had with this? We've seen some amazing efforts to change minds. Anyone here heard of McDonald's? Regularly, McDonald's executives go down to a McDonald's location in the neighborhood, they get their hat on, they serve fries, they count change. They give these executives an actual experience in serving the public, and that guides a lot of the policies, procedures, decisions they make because they see what that feels like, they see what that's like. Anyone here heard of Home Depot? Someone gets promoted to executive level or hired into an executive level, they can't take their job until they go down on the floor in the store at Home Depot and earn their orange apron. And once they've earned the orange apron, interacted with the public, with the coworkers, then they can take their executive position. That actual experience with customer service, the actual experience with the problems that the frontline workers face, that molds and shapes their desire to help them, their ability to help them in profound and significant ways. Now, let me summarize. If you want to improve results, whether it's at home or at work, you almost always have to influence someone to change their behavior. When you're trying to influence someone to change their behavior, you almost always have to change their mind. Not about everything, just about two things. Can I do what you're asking me to do? And will it be worth it if I did? The best way to change people's minds around those issues is not verbal persuasion, even though that's what we use the most. It's actual experience, the gold standard. Give them an experience with it. If you're unable to give people an actual experience with it, the tweener strategy. Go for vicarious experience by sharing stories, by bringing customers in and reporting how your service helped them, by bringing partners in, whether it be the union, supplier, or vendor, and have them share how our behavior affects their ability to serve us and to serve our customer. Field trips, stories, these become ways of changing minds in order to change behavior, in order to create significant, lasting, measurable improvements in our results. I challenge you, be an influencer, change some minds.